AB1000. I've brought the bill back in the same form that we debated last week without the amendment adding chiropractors. I think there's some key issues that got lost in the debate last week, and I'd like to touch on them briefly. Much of the language and model that this bill mimics is the Medicare model. Under Medicare, a chiropractor is not allowed to sign off on a physical therapist plan of care. If we were to authorize that in California, we might be opening up a doorway that the federal governments don't want to have open. At the very least, that issue should be carefully considered at a future date, but not here. There's been much discussion last week about diagnosis. But let's step back for a moment. Before a diagnosis, a physician or a chiropractor first evaluates a patient. Under the Medical Practice Act, the physician is allowed to order drugs and tests as part of that evaluation. A chiropractor does not have that level of medical evaluation. Additionally, if a patient goes to a chiropractor to sign off and an underlying condition is diagnosed, they will then refer the patient to a physician for treatment. Making patients go an extra appointment from multiple providers is what we're trying to avoid in this bill. Even though everyone is not happy, which is an understatement, we shouldn't throw out the best argument that is the best agreement that's been able to be forged on this issue in several years. The committee passed this bill last year, and in fact, this committee was responsible for brokering the agreement last year. So I urge an aye vote.
Are you going to take the same author's amendment you did last week?
Yes. I'm sorry. That was, yes, to clarify that we're not limiting the scope.
Okay. Witnesses in support?
Yes.
You do. Yeah. Before you go, want to establish a quorum? Roll call?
Lou?
Here.
Emerson?
Here.
Block?
Here.
Corbett? Here. Galgiani? Hernandez? Hill? Padilla?
Here.
Wyland?
Here.
Yee. We have a quorum.
I move the bill.
Witnesses in support?
Mr. Chairman and members, Tim Shannon representing the California Orthopedic Association. It's good to be here again. I'm not going to go over everything that we talked about last time. I just do want to make a point again that this is the result of a lot of discussion amongst us and the physical therapists and the chiropractors. One of the things that maybe was overlooked last week is that one of the things that is in this bill is that the Chiropractic Corporation will also be able to hire physical therapists. They currently are not able to do that, so they get something out of this bill. We think that this is a good bill for patient care in a couple of respects. Number one, it puts California among the list of states that allow direct access to physical therapists, and we think in these changing times of health care, that's important. But number two, it has important protections for the patient because it does require that there be a checkoff by a physician or podiatrist after 45 days or 12 visits, whichever comes first. Finally, it solves an issue that has troubled us and vexed us extremely much for the last few years, which is it clarifies that a medical corporation, like a medical partnership or a sole proprietorship, can hire not just physical therapists, but also any licensee that is licensed under Division 2 of the Business and Professions Code. As you heard from Kaiser last week, this solves a problem that they have because there's an illegal opinion that basically says if you're not listed in the corporation's code, you can't do it. This solves that, so it protects patients, it provides access, and it will allow patients to see physical therapists in a physician's office, which I think is very important. Thank you.
Thank you. And if presentations could be brief, I think the committee understands the issues. Go ahead.
Mr. Chairman and members, Carl London on behalf of the 8,000 members of the California Physical Therapy Association. Also want to urge your support. We appreciate your being here. Hope you had a good 4th, by the way. Just as Mr. Shannon suggested, we think this bill is a compromise. It's one we've worked on for the past 7 years. I know personally I've worked on it for that long, and it does represent a compromise. It's not perfect. There are things in this bill that we don't like. There are things that our friends in medicine don't like of the bill. I'm sure there are other provisions that others don't like. But it is a compromise. It's one that gives the patient maximum flexibility in determining where they go to get care. They have more options after this bill passes than they have today. They'll be able to get relief instantly in physical therapy. And we've addressed the issue of anyone who's had a concern about that practice by requiring an examination by a physician at some point in the process, 45 days, 12 visits. There's nothing in this bill, though, that prevents the patient from choosing to see any other provider type of their choosing at any point, getting a diagnosis, getting treated there, going back to the physical therapist with that diagnosis. Nothing in this bill restricts that in any way. And again, I just remind everybody, there's plenty in this bill we don't like. We've talked about it with folks. There's stuff in here that we like on balance. We think it's a great compromise, and we urge your aye vote.
Thank you. Other witnesses in support?
Thank you, Mr. Chair, committee members. Juan Thomas, California Medical Association. I'll be brief. I agree with all the comments that were just made. I would just also say, just from our perspective, this bill does some good things. It's going to help many of our members who are organized as medical corporations help bring clarity to how they're going to organize their businesses. As previously mentioned, this may provide the ability for some people to get in and get direct physical therapy services and provide them with options. So, like I said, we don't like everything in this bill, but we think the bill does some good things. The chiropractors get some good things out of this bill also. So we strongly urge your support. Thank you.
Thank you. Witnesses in opposition?
Good afternoon again. I'm Dr. Cassie Donahue with the California Chiropractic Association. Just want to clarify a few things. Under Medicare, we are not prohibited from co-managing or referring a patient to any other provider within the Medicare system. What is restricted under Medicare is the ability for a physical therapist to get reimbursed for a referral unless that patient has been referred by a physician. But this bill is not about reimbursement. This bill is supposed to be about access for patients to providers of their choice. As you know, we've had continued problems with many issues on this bill. The only thing that we're really asking for is this one amendment that would add us in so our patients could choose to see us at the end of that course of care of 45 days or 12 visits. If a doctor of chiropractic is not specifically listed on the disclosure that the patient signs when initiating treatment directly, they are not going to know that they can see their doctor of chiropractic, and that will restrict our scope of practice. It is not appropriate to increase the scope of the physical therapist and allow them direct access if you're going to try and reduce our scope of practice, because right now our patients know that they can see us, but if they're signing this disclosure, they will not understand that. One last thing that was brought up is that, in theory, because we can't directly manage all types of conditions, even though we can diagnose them, is that this would cause the patient to have a second referral if they saw a doctor of chiropractic at the end of the direct access period. But the fact of the matter is that we are able to treat many of the conditions that these patients will be seeing. Additionally, if they go see their medical doctor, often they're going to have to get referred to a specialist anyways, so that this doesn't really take away that step for the patient. We do believe our patients should have access to us, and this would restrict it. I respectfully ask that you take the amendment.
Thank you. Other witnesses in opposition?
Good afternoon. Robert Pulio, Executive Officer with the Board of Chiropractic Examiners. I just want to reiterate our comments from last week. Our concerns with the bill are that the patient would be receiving, and I know this isn't something that the committee is considering today, but that the patient would be receiving treatment without a diagnosis, and that's a major concern for our board. We're also perplexed. Excuse me. No, I'm sorry. We're also perplexed why chiropractors are being precluded from approving the physical therapist treatment plan. So we expressed those last week, and I just wanted to reiterate those comments.
Thank you. Any other witnesses in opposition? Again, if you could be brief, I think we understood the testimony from last week.
Thank you.
Well, I'm here to talk about the elephant in the room again, the referral for profit. There have been things that have changed since last year's bill that passed through the committee when the compromise occurred. In April 2013, President Obama, as well as all these other federal agencies and medical journals, recommended against paying for physical therapy services provided in physicians' offices.
If you could state your name for the record.
Oh, I'm sorry. Dr. Paul Gaspar, physical therapist. I represent the American Physical Therapy Association's private practice section. Thank you. So what we're talking about here is Medicare is looking at banning paying for physician-owned physical therapy clinics. It really would be an unprecedented move for us to try to legalize something that the entire nation has come out against. Lots of different policy agencies who spend 100% of their time on health care, really. Okay? I want to share one more example because the comment was made last week by one of the committee members that the doctor will let you go where you want. I've had 2 experiences where this was not the case. 2 of the local orthopedic groups asked me to run their physician-owned physical therapy clinics for them. The first one said, just so as you know, if you come and run my clinic for me, you will see 100% of my patients. But if you don't run my clinic for me so that I can make money off of you and your services, you will never see a patient from me again, and whoever does it for me will see 100% of my patients. The second instance was a clinic, orthopedic clinic, and the CEO told me, if you come and run the clinic, then you will see the patients for 3 times a week for 12 weeks, no matter what. And if any of your therapists does not comply by that dictate, I need to be able to come in and fire them immediately. I think you can see here by these 2 examples why all the studies and all the public policy makers are going in this direction. There is nobody who thinks that this referral for profit, physician-owned clinic, or any type of referral for profit to imaging, radiation oncology, radiation therapy, it's just a horrible idea. It's certainly not worth the trade. And in closing, I just hope that we can focus on the policy here. This is an extremely damaging compromise, and it will spell the end of our independently owned physical therapy clinics, unfortunately.
Thank you. Other witnesses in opposition?
Hello, my name is Dr. Jeff Fairley, speaking on behalf of the Independent Physical Therapists of California. After the last hearing, both I thought Senator Yee and Senator Hernandez both identified the complexities around AB1000. And I would like to first say that these 2 issues started as 2 separate issues in which our Physical Therapy Association was very united in opposition to physician-owned physical therapy clinics, as we were on AB 783 at the last go-around, as well as being in support of direct access. I had an opportunity to pull up and I apologize for the small print, but it's a poster presentation provided at the American Academy of Orthopedic Surgeons on March 19th of this year, and identified a private practice orthopedic clinic that was seeing reductions in their revenue for their professional services as reimbursement is declining. But what is keeping that clinic afloat is their ancillary care services, namely their imaging, their physical therapy, their hand therapy, and their durable medical equipment. In other words, what is keeping this medical corporation profitable is their ability to profit from what physical therapists are doing in providing professional services in a physician-owned physical therapy practice. This is a clear and obvious conflict of interest. It's an avoidable conflict of interest. The law already states that it's illegal right now, and it never has been legal. There's no need or reason to undo the Must-Own Act and allow 14 other professions to also be able to own physical therapy services and profit from the work that we do. These bills are complicated, but really it boils down to the bottom line. Orthopedic surgery believes that they can earn $100,000 per physical therapist per year. That is the driver behind this bill. The direct access is a complicated bill. There's issues with diagnosis. It was poorly thought out. It was not well articulated in getting all the interested parties involved to figure out what is necessary to achieve direct access for the citizens of California. That's unfortunate. But this is not a good compromise. It's going to set our profession back, and ultimately it's going to harm the citizens of California. Thank you.
Any other witnesses in opposition? I've got a question for you. If in fact, this bill results, or according to your testimony, will result in unnecessary increased utilization, why aren't insurance companies opposed to this bill?
I can answer that, Jeff.
Sure.
There have been a few payers who have looked at reducing reimbursement for physician-owned physical therapy clinics or not paying for it at all. What has tended to happen is that the orthopedic surgeons have gotten together and have said that they will no longer take the surgery patients. And they need to be able to provide a panel for orthopedic surgery to cover the entire state, so that the insurance companies have largely looked the other way. I think Anthem Blue Cross was probably the best example of that.
Okay, thank you. Questions or comments from committee members? Senator Corbett?
I have a question for probably Mr. London. So an issue we discussed last week was whether physical therapists will be paid because the appropriate codes are not available. And I have to honestly tell you that it seems problematic that there would be a bill that we're passing that doesn't allow for the payment of the physical therapist. So I'd like you to help me understand why you believe that payment can occur even without the codes.
Chairman and members, thank you for the question. We've looked at what's happened in the other states, and our confidence in supporting this comes from the fact that in the other states where direct treatment is allowed, the insurers have in fact moved forward, and as was discussed last week, certainly codes are used to describe what services are being provided in order to establish a code for billing, and there's no problem in using those codes for our people in practice. And we've also even asked the licensing board, because one of the questions that was raised last week was that somehow this would be inconsistent with the license to be able to use a diagnostic code, which is used for insurance billing. And the licensing board has said they don't perceive any issue around that at all. In fact, that the codes are used exactly for what I described, to describe their procedure that's being performed and the type of situation you're working with the patient. So having seen all the other states, how they do this, the fact that we can get reimbursed under Medicare and use codes, we're not at all worried about that, just to be perfectly blunt. We're really not. We're actually quite confident about it. And as I mentioned, in an 8,000 member association where we have people who have come from other states, some of our members own practices in other states. We're not unconfident about that at all. We don't see any problem with that issue. I mean, 100% unequivocally, we have no fear of that issue at all.
So in those states, did the program begin without codes as well, and then the program evolved, or how does this compare to what was done in other states?
I certainly could ask, some people with more expertise in the insurance billing, if you like, but the way I understand it is that they actually allow the use of the codes for the appropriate procedures being performed, just as physical therapists today are required, whether they get a patient from another source or not, to use codes to describe their work they're doing for billing purposes. That won't change. The same procedures that we do today, that we bill for, will simply use those same codes to bill under this model. All this really deals with, as Mr. Wachowski described, is that we've built in, a legislatively sort of guided process where the patient will be able to see a physical therapist for treatment for a certain period of time, number of visits, after which time the legislature in this bill is calling for kind of a check just to make sure that medically there's not some underlying thing that needs to be examined more closely just in case. And at that point, just like in Medicare, the physician could sign, or podiatrist could sign off on the plan of care that's developed by the physical therapist, and the patient can resume treatment. Or another route is that they go see a different provider who makes a diagnosis on the patient, and they can send them right back to the same physical therapist for treatment as well. So there should be zero disruption at all, except that we've now created another opening. And by the way, the 45 days, 12 visits is sort of important to look at. The standard in the profession for treating patients that we studied shows that most patients resolve in 6 to 8 visit range. So in theory, most patients are going to be done before this time period or visit limit comes up anyway and be taken care of at that point. The ones that won't will need further check under this bill, and we'll live with that.
I do have one more question. As you know, this bill was put over from last week to give an opportunity to hopefully work out some of the other issues that were raised last week. Were any of those issues worked out through the discussion? And I'm particularly interested in hearing about the amendment that the chiropractors requested. And what happened? Was that discussed? Did the parties get together and discuss that? And what's the result?
Well, the result, I'll go backwards, is that we're not going to accept that particular amendment. What we did is we had both all three parties, the orthopedics, the doctors, and the physical therapists, go back to their groups and discuss with them the impact of the language and whether it would be acceptable. I instructed every one of them to go back and see if the language was acceptable. They came back after that with the notes that we made about the Medicare and that this would create more confusion, and felt that with the language that was requested by the committee, that we clarified that we're not limiting anybody's particular field, their scope right now, that combination should be satisfactory. So that was, we're not trying to impinge on anybody who's working in the field right now.
Senator Hill.
Thank you, Mr. Chair. This has been a real struggle, as it was last year or the year before, or the year before, whenever it was. It seems to be recurring. I know the issue of chiropractic, as Senator Corbett mentioned last year, was the amendment that was asked to be considered. And I don't know if Mr. London or the authors, but you've indicated that the chiropractors, there were a wish list, or there were 10 items or so that they had that were on the table, and that this compromise that has come together this year included 9 of those, and that the last one is really the diagnosis issue that's not included in this. And the sign-off. Could you or someone kind of mention what those were? Maybe I see Monica Miller's here from chiropractic. I'd be just interested to know what, since this was a compromise.
Well, we have a proponent witness respond, and then we'll have an opponent witness respond.
Very good.
Senator Liu, excuse me, Mr. Chairman, Senator Hill. In the process, we'd received communications in the form of letters, and otherwise we'd had a meeting with the chiropractors last year, and we well understood what that list looked like. It was longer last year. Some of the issues, as Mr. Shannon said earlier, have been addressed. For example, what I understood to be the most important amendment at the time was to allow within the bill the ability of chiropractic corporations to be able to employ physical therapists just like physician or medical corporations. That's in the bill today. A chiropractic corporation can clearly employ a physical therapist along with other healthcare providers. Another was there was a mechanism for sort of during the process of if a physical therapist was seeing a patient and an issue came up that fell outside their scope of practice, the physical therapist then was instructed in this bill to refer to an appropriate provider. There was a list of providers in there. The chiropractors wanted to be included in that. They're in that. This last one on the plan of care, being able to sign off on the plan of care, I think is where we've drawn the line for now. We don't see it as being consistent with Medicare. Medicare has clear rules, and Medicare, by the way, just so we all understand, the federal government has already said under the Medicare program for people that qualify, they will allow and pay for direct treatment by physical therapists in the states where that's allowed. California is not one of those states today. That's what we're changing, hopefully, in this bill. So now we'll be able to do that under Medicare if we have a Medicare patient. Medicare then goes on and says that it has further rules, that if that does occur, they require a sign-off on the plan of care, a certification on the treatment plan that we're working with. It doesn't require, as this bill does, an examination by a physician, but they still have to sign off on it within a certain prescribed time period, very similar to this bill. So we've, in all intents and purposes, with some tweaks, copied that. Chiropractors are not in that list, and I misspoke, I think, last week. I had thought dentists were in that list. They are not, but they are expressly prohibited from doing that and signing off on our plan of care for direct treatment. So we've chosen to copy that. We think it's a reasonable standard to copy. If it could be looked at some point, but we don't think that's the purpose of this bill. Purpose of the bill, from our perspective, is the marrying of these two concepts to allow cross-employment, and secondly, to allow patients direct treatment by physical therapists, and those are the things we're satisfying in the bill. We haven't, as I've mentioned to you before, we certainly are not getting everything we want in this bill. There's a lot of other things on the table for us that we're choosing to compromise on, as our physician counterparts. There's things they don't like in this bill, I guarantee it. They've told me time and time again. I'm tired of hearing about it as well. But we are compromising, and so this, in the grand scheme of compromise, it's a pretty good deal.
Mr. Chair and members, Monica Miller on behalf of the California Chiropractic Association, and I need to set the record straight. We actually have not had one single meeting with the Physical Therapy Association on this bill. When SB 924, that was a gut and amend last year on the Senate floor, the last day of two-year bills being able to move, when these two issues were merged together, it was then sent to the Assembly, and we began meeting with committee staff in this House as well as other co-author committee staff, our personal staff, met for several weeks. They had agreed to several of our amendments, and then we were told a week before SB 924 was heard in the Assembly Business and Professions Committee, they're not taking any of our amendments. The Physical Therapy Association is now the sponsor of this bill. They were never at one of those meetings. When this compromise came together, we were not invited to the table. We were opposing Mr. Wachowski's bill, Assemblyman Wachowski's bill, AB1000, because we do absolutely oppose direct access. We think it's dangerous for a patient to be seeing a provider without a diagnosis. It's very dangerous. Additionally, there is no mechanism for reimbursement. I know that maybe this has been done in other states, but I have to tell you, they will be billing with a diagnostic code, not a CMPT code, a diagnostic code. So they're duping the insurance company and they're duping the patient, because the patient is going to go see a physical therapist, not understand that they're not having their insurance company reimburse, and then they're going to get a letter in the mail from their insurance company saying you now owe X amount of dollars. That's what ultimately is going to happen, in our opinion. And again, I'll tell you, we had one meeting with Assemblyman Wachowski's office, actually two meetings, pardon me. One meeting with his staff where he was kind enough to join us because we knew he was very busy. Another meeting with him. We have not had a single stakeholder meeting with any of the proponents, So I just want to make sure we set the record straight on that. So there was no, here are a list of demands, and they met all of them. Here's what we asked for, and they met all of them, because there hasn't been any of those meetings. Those stakeholder meetings did not take place with our presence. So I just want to make sure everyone understands that. And there are a number of issues in this bill. We think it's a terrible bill. We've said that to all of you. We've said that to your staff. But at the end of the day, we are asking for one amendment. As we go into the ACA, we believe it's very important for consumers to be able to choose the provider of their choice and get in the door. I'm a member of UC Davis. Right now, if I call my physician, who I have a great relationship with, 3 weeks to get an appointment. ACA, I'm guessing it's going to be about 6 weeks. She's not going to stay there longer hours. Her clinic's not going to open on the weekends just to accommodate the individuals who have insurance cards. If I call my chiropractor, I can get in within 24 hours. I need to know what's going on with my shoulder if I've hit that maximum. It could be cancer, and I've seen people go from 0 to 12 weeks and die from cancer when they thought it was just, a little lump. We're not sure what's going on. It's just a little shoulder. It's a little painful. That's why we are asking to be put into this bill. It's not unreasonable. It's part of our scope of practice. As we mentioned, this bill doesn't deal with reimbursement, so that's an inappropriate argument in our opinion. We urge you to vote no on this bill or to have the author take our amendment. Thank you for your time.
You dispute proponents' arguments that Medicare does not allow for chiropractors to sign off on a plan of treatment?
We, under Medicare, we can sign off on the treatment plan, but if we refer a patient to a physical therapist, correct, the physical therapist will not be reimbursed. So we don't dispute it, but we don't agree with it. But again, this bill does not deal with reimbursement. That's a whole different issue. So for them to say and point to the reimbursement aspect, this bill isn't dealing with reimbursement. Under this bill, if it's passed and signed into law next week, insurance companies aren't going to be running to reimburse PTs. They've never actively engaged in this. They've never sat at the table on this. I've been working on this issue for at least 7 or 8 years on the direct access side. And again, these issues only got merged together last year in a gut and amend with no policy committee in this House. No policy committee discussion. It got over to the Assembly. There was one policy committee discussion, and then it got halted on the Assembly floor because of a CMA amendment.
Thank you. Any other questions? Senator Galgiani.
Yes, I had a question. I have received chiropractic services, and if I had sciatic pain again down my leg from a pinched nerve, I would go to a chiropractor again and again and again, and I have paid out of my pocket to have that direct access today because I need it today. I've also worked as a physical therapy aide, and so I'm having a hard time seeing, maybe you can give me some example of a case where a chiropractor would refer to a physical therapist, and what modality. I mean, it wouldn't be hot packs or electric stimulation or ultrasound because chiropractors do that. So
I'm going to let Dr. Donahue, as an expert, testify to that, if that is okay, or answer the question. So, thank you.
Thank you. Actually, doctors of chiropractic refer to physical therapists a lot. Not all doctors of chiropractic do the different modalities, the hot packs, the muscle stim, the ultrasound, that sort of thing. So often they will refer a patient who they think needs those modalities to a physical therapist to perform those. Also, there are cases where a patient would be benefiting from more like rehabilitative things that the physical therapist may have more equipment in their office if that's what they're specializing in, and the chiropractor may not. But having said that, as a chiropractor, I can, because my practice has a bunch of different stuff in it, I don't necessarily have to refer very often to a physical therapist because I'm already treating and have all the equipment that I need to be able to do that.
Mr. Chairman, if I may take a stab at that question as well, if Senator Galgiani wouldn't mind. I mean, again, there's nothing in this bill that limits choice for any patient. In fact, it only expands it, but there's nothing in this that limits the patient's choice at any time in the process prior to the 45 days, after the 45 days, 12 visits. Nothing in here changes this in any way. A patient at any point in time after seeing and directly accessing a physical therapist could choose to go to a chiropractor anytime they want and have the same payment issues that they might have otherwise. If they're paying out of pocket, that's their choice. If they're covered, it's their choice. They can go see the chiropractor. It could be prior to the 45 days. The chiropractor could make a diagnosis, send them right back to physical therapy. Nothing in this bill impedes that. In fact, if anything, all it does is open up more choices, because now you could also see, and it was described earlier that there's a problem in getting in to see physicians. This now opens a whole other door, because you could now go see a physical therapist directly, begin treatment, and then we have a check after a certain period of time. Honestly, we'd prefer that 45-day, 12-visit limit wasn't there, but it is what it is in the interest of a compromise. Secondly, I've handed out, Mr. Witkowski had a piece of paper that gives you right out of the Medicare manual what the rules are with regards to signing off on the plan of care or certifying a plan of care for a physical therapist. And it's very clear. We've highlighted it for everyone to take a look at that. And it's pretty clear that there are only certain providers that can sign off on that plan of care. Chiropractors are expressly not allowed to sign off on our plan of care to certify our plan of care under Medicare. We chose to copy that standard. Again, it's a compromise.
Senator Block has a question.
Yeah, thank you, Mr. Chair. This is a troubling bill for a lot of reasons. One, in past years, I know I've spoken with folks from CMA and from the San Diego Medical Society who've told me that it would be really bad to have physical therapists see patients without being referred by a physician. And they raised, CMA then raised, the doctors raised the same arguments, or some of the same arguments that the chiropractors are raising now. One of my San Diego physicians said, if physical therapists want to see people, without a diagnosis or diagnose themselves, they should go to medical school. I mean, they were pretty clear up until this year. So I would ask, that's an observation. Maybe someone from CMA can tell me what's changed. Second observation, because it goes on both sides, the chiropractors say that the first chiropractic witness said that the main thing they wanted was an amendment that would include them. Then the second chiropractic witness says they're very concerned because this bill would allow physical therapists to see somebody without a diagnosis. But that's okay as long as you're included at the back end. I mean, they're so disingenuous, it seems, on both sides. So please explain.
Juan Thomas, California Medical Association. Thank you, Senator. The issue for us, and we do have problems with direct access. The issue for us is on the corporations fix, and this is the part of the bill that's a big deal for us. And it's a big deal for us because we have a lot of members of our association who have chosen to organize their business as a medical corporation. In the course of this discussion, there was an opinion from Ledge Council that threw a lot of ambiguity into whether or not medical corporations could hire physical therapists. That started in 2010. Each year, more and more of our members who are organized this way are under more and more uncertainty about their businesses, about people who they've employed for years, who are part of their family. They're getting threatening letters, have received threatening letters from the Board of Physical Therapy that they're in an unlawful employment situation. So, for us, it was, do we continue to let this build up, and then that our members and people that they've employed for years who are part of their family ends up with serious disruption of their businesses? Or do we look at this and say, given, is there an appropriate amount of direct access? And if that is true, then how do we then protect patients, right? So, we live in a world where we have to make compromises. This bill, we would have, we started out with our own bill. The two came together over in the Assembly, so therefore our corporations fix is in this bill. So, if the two bills are together, then we have to then go about making sure that how do we look at this from a patient safety standpoint, which is where the 45 days, 12 visits, the referral to a physician surgeon for signing off, that comes in. There's some other patient safety issues. But that's what's changed. It has become a more acute problem amongst our members and the people that they've employed, and our members include Kaiser. They employ hundreds of PTs in Kaiser South. They are organized as a corporation. So getting clarification on this issue is important to us. And it's important enough to where we've, I think, wisely stepped back and took a fresh look at the direct access and figured out how, in a thoughtful manner and in a manner that protects patient safety, that we would give some amount of direct access. And that's where we are. We're in a democracy. We're in a place like this where we had to give something. And to the physical therapist credit, they gave something too. So that's what's changed. It's become more of an acute problem for us, and this is something that we would like to, in order to help our members, get some clarification with this corporation's fix.
Thank you.
And we'll let the chiropractors answer your second part of your question.
So with regard to that, this is a compromise bill, and we don't like it. We don't believe that physical therapists should have direct access. However, this bill has been moving forward. Leadership appears to want this issue to be taken care of. In that respect, we do feel that our amendment is important to be taken because while the bill does not say you can't see a chiropractor, it does have a disclosure that the patient has to sign that only lists an MD, a DO, and a podiatrist. If that patient is following that at the end of their direct access window, they're not going to even have a clue that they could go see any other provider. They're going to believe they have to go see an MD, a DO, or a podiatrist. So this does limit our scope of practice. With regard to the Medicare issue, no, we cannot sign off.
That wasn't a
okay,
question.
I'm sorry.
Just comment, and I'll be done. I just hope that in the political machinations, understanding we make compromises and everything else, and everybody wants to be included when they can to boost their profession and expand their scope, I just hope that patient safety is not being lost in all this, because that was clearly a concern in previous years. Now I hear everybody's making compromises for corporate reasons, and I don't know what patient advocate is speaking here, but it's not the folks in front of me, I don't think.
Well, I think, if I could... No.
You know what?
Just very briefly.
He was making a comment. He was asking for
I don't need an answer.
response.
Yeah, you didn't respond.
Anyone else have any questions? I think Senator Emerson had a motion first, so we'll take Senator Emerson's motion. And the motion is due pass as amended to Appropriations Committee. Roll call.
Lou?
Aye.
Lou, aye. Emerson? Emerson, aye. Block? Corbett?
Aye.
Corbett, aye. Galgiani? Galgiani, aye. Hernandez? Hill? Padilla?
Aye.
Padilla, aye. Wyland?
Aye.
Wyland, aye. Yee. There's 6 votes.
we missing anyone?
No, that passes it out.
The bill is out. And meeting adjourned. Oh, I'm sorry. When we call the absent, I want to call the absent members before we adjourn.
Block. Aye. Block aye. Hernandez. Hill.
Aye.
Hill aye. Yee. 8-0.
Bill is out, and we'll adjourn the meeting.